Nigeria's health system has been ranked fourth in Africa as the federal government approved 32.88 billion naira under Basic Health Provision Fund to strengthen primary health care, expand health insurance coverage, and enhance emergency response nationwide. Coordinating Minister of Health and Social Welfare Professor Mohammed Ali Pati said over 235 billion naira has been disbursed through the fund in the last 3 years, supporting more than 8,000 primary healthcare centers, while all 36 states have received emergency funds to bolster Ebola preparedness and enhance universal health coverage.
The Honourable Minister of State for Health and myself chaired the 15th Ministerial Oversight Committee on Basic Healthcare Provision Fund, on the Health Sector Renewal Investment Initiative, and other key national health programs. This is a quarterly meeting which reviewed progress, looked at challenges, and made decisions on where we go next. The expanded ministerial committee comprises federal government agencies, the Ministry of Health, the state commissioners of health, state primary healthcare agencies, state health insurance authorities, our key development partners, civil society, and other relevant ministries. What we discussed was the progress that is being made in implementing the Nigeria Health Sector Renewal Investment Initiative, which was flagged by Mr. President Bola Ahmed Tinubu in December 2023, which has garnered steam, and we're beginning to see a lot of progress. That progress is thanks to resources that were the anchor resources of the Basic Healthcare Provision Fund. In the last 12 years of the Basic Healthcare Provision Fund, 339 billion were disbursed to states, out of which 235 billion were disbursed only in the last 3 years of President Bola Ahmed Tinubu's administration. This shows the intensification of the effort to expand primary healthcare under this administration. And with those resources, primary healthcare centers, more than 8,000 of them, all over the 36 states and the Federal Capital Territory of Nigeria, have been receiving resources on a quarterly basis for primary healthcare through the primary healthcare agencies, for health insurance through the Vulnerable Groups Fund of the Health Insurance Authority and the state health insurance authorities, through NCDCs for outbreak control, and also for the emergency medical services. With those resources, we have seen continued progress in terms of utilization of healthcare services, expansion of emergency medical treatment. 35 states already have their own structures, while 2 states, Benue and Imo, do not have their own state structures but are reliant on federal institutions in their states. Through that program, more than 130,000 personnel have been attended to using the emergency medical services provided by the Basic Healthcare Provision Fund. The NCDC has been using its gateway to provide support to states in outbreak control, trying to assess, detect, enhance surveillance, and help states to be ready to respond for cholera, Lassa fever, and other diseases like cerebrospinal meningitis, and even now with the Ebola virus disease that is in the Africa region, even though it is not in Nigeria. As you may have heard a few days ago, the Ministry of Health used resources from BHCPF to approve the disbursement to all the 36 states to enhance their preparedness against Ebola. This is complementary to the great stride, the great decision of Mr. President to set up a presidential task force that is multi-sectoral, so that Nigeria enhances its own preparedness.
The committee called for stronger accountability mechanisms, sustainable healthcare financing, improved coordination among key institutions, and the resolution of operational gaps to enhance implementation. Development partners also stressed the need for better alignment on the sector-wide approach, evidence-based decision-making, efficient resource utilization, and stronger collaboration. Discussions further focused on boosting emergency preparedness by reviewing molecular diagnostic laboratories and isolation centers to strengthen Nigeria's public health response capacity. Comfort Olayinka, Alpha TV Network.